Hey everyone, Dr. Matt Panetti. Welcome to another episode of Primetime Health TV. Today we're talking about 2 stretches that you should be doing if you've got back pain. Because back pain can come from a lot of different factors. But the one factor that I see coming from the most is sitting. Sitting in your car, sitting at your desk, sitting on your couch. Sitting is a terrible position for our low back. And so we can do a couple things to help relieve some of that pain. Now understand, these stretches are never going to fix the underlying problem. They're going to help get a little bit of relief, but the problem's most likely still going to be there. So until you correct that, you're going to continually have to come back to these. But regardless, these are really important for getting you through the day and helping you push through life until you can get that core problem removed. Okay, here's the first stretch. It's called the piriformis stretch. Find a nice place to sit, cross one leg over the other, push the knee down, pull the foot up like that. You're not going to torque too hard. I don't want you to really put a lot of force into this. Just gentle amount down on the knee and a gentle amount up on the foot. The thing that's going to really get the stretch to go deeper for you is to sit nice and tall and bend forward. As you bend forward, you're going to feel that going down the back of the leg into your buttocks. That's the piriformis muscle that you're feeling light up. Piriformis muscle gets really tight when you're sitting for long periods of the day. So if that's tight for you, it's a good indication you need to be doing more of it. And I'd be doing anywhere from 20 to 30 seconds, switching sides, and doing that, repeating that throughout the day. Second stretch that I recommend is a stretch for what we call the QL, or the quadratus lumborum muscle. It's a muscle that runs from the ribs, the bottom of the ribs, down to your waistline. So you want to find a wall, cross one leg over the other, reach up with the opposite arm, point towards the wall. Once you've done that, switch, go the other side, stretch the other side QL. Again, the QL starts at the ribs, bottom of the ribs, and goes down to your hip and pelvis bone. The QL muscle, when it gets tight, you're going to feel pain, strain. A lot of people mention pinching in through the low back, and that a lot of times is due to that QL muscle misfiring. So get to work on those. Let me know how it goes, and I'll be happy to answer any questions if you have them. Best of health to you guys.